Welcome to Apollo Spectra Facebook Live session. It is an interactive session that regularly happens from Apollo Spectra Hospital, MRC Nagar, by our top specialists from our different medical and surgical departments. We hope you tune into the session and ask a doctor for any query you might have. We introduce our senior consultant dermatologist and dermatologic surgeon, Dr. G Ravichandran, who is specialized in vitiligo surgery and cutaneous oncology. And he has also have more than 15 years of experience and also conducted many dermosurgical workshops for dermatologists and many CMEs. And he have many publications and presentation to his credits at national and international levels. And here to you, sir.
Good morning to one and all. Thank you for coming over here. Today's topic is called vitiligo, always called Leucoderma. So we will address this disease and its causes and how it is to be managed and treated, and what best can be done to these affected individuals.
So, what is vitiligo, sir? Can you tell us about this disease in detail?
Yes, vitiligo is a very ancient disease. It has been there in the world for so many centuries. We call this as vitiligo, that means otherwise commonly called as leucoderma, wherein the skin color in different parts of the body disappears. So that leaves behind the brown colored skin will become white in color. The patches, the melanin, so actually what is happening here, we have a cell called melanocyte. The pigment producing cells in the basal layer of epidermis, which is getting removed by one's own system. There are different causes for that. I will arrange for that. Come to the topic later. So vitiligo is, as I told you, can affect any part of the skin. We classify them into different angles, different types. So how does it present? The skin becomes white. So it can be a small white spot, or it can become a large patch. It can involve the face and other areas of the body.
So, how common it is, doctor?
Vitiligo is a very common disease. No, world over, it is around 1 to 2% of world population suffers from vitiligo. And in India too, we have, since our skin is in the darker shade, and it is obviously seeing to the external appearance. So we have around 1 to 2% of patients, both men and women, suffer from this depigmentary disorder called vitiligo.
So, who can normally get it, doctor?
Yes, anyone can get this, from the small age to the children, adults, young boys and girls, men and women of different ages, different sexes. This is very important, that this disease affects every individual in different age groups. So we need to understand this progression of the disease and explain what are the common, how does this disease behaves in different individuals.
So, what are the treatment option available for this disease, doctor?
Before we go into the treatment options, we need to classify the types of vitiligo. So there are, how does it can present on an individual. So it can, as I told you, it can be only on the mucosal surfaces, sky lips. There are men and women who gets only the white patches on the lower lips or the upper lips. If they have a lip vitiligo, they can also develop vitiligo over the fingertips called acral vitiligo, lip tip vitiligo, otherwise called the leucoderma. And this is generally confining into the acrofacial vitiligo. Then we have small patches, 1 or 2 patches here and there in the body or the face or the arms or the legs. We call this as focal vitiligo. And there is another type of vitiligo which confines itself only to the one part of the body, one side of the body. So take for instance, on the forehead, on the face, on the upper eyelid, on the leg, on the forearm. So it is called a unilateral or segmental vitiligo, which is a very interesting condition, because this can remain, generally it does not spread to involve the other parts of the body. And the treatment options are also different. When I go into the topic of treatment, I will let you know how to proceed with the different types of vitiligo patches which can be treated. Then we have a generalized vitiligo. That means the white patches called the depigmentation spreads every part of the body, the face, the hands, the legs, and the body. New patches keep developing, and the patients can completely lose its color so that they become totally white. Yes, what are the treatment options available? Okay, so we have to do some kind of an first we need to discuss with this patient what type of disease they have, how long it is there, what is the duration of the disease, is it genetically determined, is it there in the other family members in the family. Number three, the another one is called how long it is there. Is it becoming normal with treatment or without treatment? Is it self-limiting disease? Or what are the treatment options which are they already taken, or what else can be done? And we need to assess this type of vitiligo and the extent of vitiligo, and then ask for small test whether is it associated with other disorders, like as I told you, it can run in families, it can, that's very negligible amount of patients who develop vitiligo as a genetic transmission. Don't have to be worried. Then we have the thyroid autoimmune disorders, because as I told you, vitiligo is an autoimmune disorder. So it can be associated with the thyroid disease like hypothyroidism. It can be associated with the diabetes. It can be associated with other skin conditions like alopecia areata, psoriasis, lichen planus. So certain drugs also can cause precipitate white patch disease. So this is one thing. When we see the patient, we identify the type as I told you, and is there any new patches developing? If the patches are stable, is it patches showing small color on its own or with medical treatment called repigmentation? We have a nice protocol to assess the condition so that we plan according to the treatment options available.
So, what is the new medical treatment in recent times, doctor?
Yes, I am here to complete my talk on treatment options which are available. So we have the topical medical treatment, surgical treatment. What are the medical treatment we give? We give topical creams like topical steroid, topical tacrolimus, and then we give oral tablets like medications. Like if it is fast spreading vitiligo, if it generalized vitiligo, we need to give systemic steroids called oral steroids. We have other newer agents are also available. Phototherapy also is generally popular in every aspect, particularly the patients who develop extensive vitiligo, we ask them to go into UV light chambers. We have a narrowband UVB phototherapy, which is available modality for patients who develop vitiligo all over the body, generalized vitiligo. And then we have a tablet called 8-methoxysoralen called PUA treatment. PUA treatment is also very commonly seen, but there are a little cumbersome again. And we have lasers are also available. Coming to the phototherapy part, we have targeted phototherapy, we have an excimer laser, but these phototherapies like targeted and excimer lasers are newer options, which we use it following any kind of surgical treatment. Yes.
So, any surgery can be done for this, doctor, for this vitiligo?
Yes, those patients who do not respond to medical therapy, if the patient's disease is become stable, if the patches are not becoming larger, if we see some small brown spots in the center or the edges of these patches, we take them for kind of a simple procedure called vitiligo surgery. Vitiligo surgery has become a very interesting in India, that our association has arranged this to be delivered to all the medical colleges and taught our postgraduates and assistant professors to how to perform this simple procedure. We have different options of surgery. We have a punch skin grafting. We have a ultra thin skin grafting. The latest one which we have been doing in Apollo Spectra Hospitals is called melanocyte keratinocyte cell suspension, called non-cultured epidermal cell suspension, which gives an excellent result, because usually it is done under topical or local anesthesia. Maybe we can take up these sessions, 2-3 sessions, so that we cover the areas which are generally we prefer to do this on the sun exposed side, because that is going to cause a lot of cosmetic disfigurement, because this the disease, no, with particularly young girls and boys, causes low self-esteem. This causes depression, psychosocial isolation. To taking that into consideration, these type of procedures will definitely give a best results for them, so that their comfort zone is improved considerably well. I would like to show you one picture. This is a condition called vitiligo, called segmental vitiligo. This is before treatment, and this is after an NCS, non-cultured epidermal cell suspension. This patient actually went through a procedure 1 month ago, and we have got the repigmentation called the nice smooth with good color match and excellent results in within matter of 2 to 3 weeks. And with medical treatment and little lasers and phototherapy, the whole patches will becoming normal without any obvious change of surgical intervention or any kind of darkness, because the color match, the texture, everything becomes all right.
So, how to prevent this vitiligo, doctor?
Yeah, very good question. Because how to prevent, it's very difficult question to answer, because anyone can develop, but generally, as I told you, associated autoimmune diseases can be there. We need to screen them for thyroid disease, and then any B12 or vitamin deficiencies have to be assessed. And once it comes, it has to be seen well, and then it's make sure that this doesn't spread all over the body. And we have definitely have a ways by which we stabilize this disease, try to get the pigments back. We have a new treatment options across the world coming up, and there are phase 3 trials which are happening in other countries, particularly in Western countries, that the new reagents will be available shortly in India.
Is there any specific type of food which causes this vitiligo? Is there anything, something like
No,
that,
no, no, no.
doctor?
Actually, we need to, because it is, as I told you, it can be also related to kind of a vitamin deficiency. So, patient should not restrict on any diet. So, they have to continue to take normal food with a lot of low fat, high fiber, high rich in vitamins and proteins. And sometimes they should not over stress themselves to going in the sunlight, because those patients who develop vitiligo on the face can develop little sun allergy. So that can be triggered. We talk about a condition called Kubner phenomenon. Kubner phenomenon can happen, that is, disease can spread following injury, following sun exposure, sunburn. No? Sometimes in summer months there is UV burn occurs, ultraviolet radius burn occurs, so that can trigger this disease.
Can this vitiligo will be present at birth also, doctor?
Yes, congenital vitiligo can be there in certain people, individual babies, so that it generally confines itself to a localized type that can be differentiated when the child is seen well.
So, what would be the cause in babies, doctor, for this vitiligo?
Genetic history have to be ruled out, but generally, as I told you, there is actually the reason for vitiligo early days is unknown. But now we have been identifying the factors involved. As I told you, it's an autoimmune T cell disease. That means there's a kind of a body's immune mechanism trying to go and destroys the pigment cells called the melanocytes.
You have explained as the type of vitiligo. Is there any specific type which will spread faster, doctor?
There are patients which they develop vitiligo, generalized vitiligo within a matter of 6 months. It starts in the face, it starts in the body, suddenly it becomes all over the body. The patients can even develop the hairs can be bleached, called these white hairs can develop, and these affected individuals have to be properly investigated and proper care and treatment, particularly for quite a number of years. It is not easy for us to quickly treat this individual. Sometimes we reassure them we may not be able to help certain individuals to get back the color.
So, is this disease is painful, or will it affect any skin or hair? Is it like that, doctor?
No, does not cause any kind of a symptoms except for kind of a cosmetic disfigurement. And then this can also affect the hair roots. That's why the young boys and girls or whoever is affected can develop white hairs, particularly over the patch or on the scalp hair or the eyebrow hairs if it is localized in the facial region. And it is not, I wanted to inform that very important, that it is not a contagious disease. This does not spread from one individual to another individual, and it does not cause any kind of a transfer to the other people. So those days it was thought to be about leprosy, which is a condition which has been almost eradicated by the World Health Organization. It is nowhere related to leprosy. This is not kushta, and one has to be very clear that this is reassurance have to be given to the parents as well as to the affected individuals.
So for this vitiligo, can it be cured, doctor?
We talk about cure, no, it's a very interesting, certain diseases cannot be cured, but when we stabilize this disease, we treat the disease, the autoimmune process can be halted so that the destruction of the melanocyte is stopped and one can get the pigments back. There are other areas wherein we are not able to achieve much good results, and we, in those individuals which we have been long standing, we try to give some camouflage cream in the form of a makeup cream so that the skin color, the white patch is colored up with a neighboring skin, so the patient feel little more comfortable.
Uh, so will our eye color changes because of this disease, doctor?
No, 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 very unlikely.
So is there any particular blood test to do for this, doctor, once after we get any this vitiligo?
Yes, actually, as I told you, sometimes we do a small skin biopsy in the early stages of patches. You know, sometimes we are difficult to make a diagnosis. Is it vitiligo or leprosy or any other cause of hypopigmentation? We take a small skin biopsy to confirm whether it is vitiligo or not. But there are no blood tests specific to vitiligo because we don't have much biomarkers study in the world, and there are developments, new developments which are happening to identify the biomarker, which is not generally practical in day-to-day practice. And we always rule out other associated conditions like hypothyroidism, thyroid disorder. We perform a thyroid function test. We assess the serum B12, serum folic acid. Vitamin D plays a major role in kind of an autoimmune disorder. In every disorder, I think we need to rule out any vitamin D deficiency, and also diabetes to be ruled out in these individuals.
There's one more question from the audience poll, doctor. That is, what do you do with CKD patients with vitiligo? Like when when they cannot provide any steroids?
Yes, we sometimes give you topical steroids and topical tacrolimus in these patients because the primary disease is more concerning, and then we need to look into the CKD part so that we need not be worried about this treating the individual. Maybe if the condition of CKD becomes okay, then we will take up this topic of vitiligo, which is if it is seen over the sun exposed areas or on the facial skin, we can do some kind of a treatment so that the patient gets back the repigmentation again.
So the medical treatment in recent times, doctor, any new medical treatments?
Yes, we have a very good options now across the world, but in India it will probably shortly coming. We have a called JAK inhibitor, Janus kinase 2 inhibitors, topical cream and oral medications have started. We have a condition tablets called tofacitinib, which is not approved for the use of in vitiligo, and we have topical tacrolimus. Tofacitinib is also in the cards in the future, probably within a matter of a year or two it will be commercially available because it is completing phase 3 trial in the United States.
So I just wanted to ask other thing, doctor. So vitiligo, when the patient got vitiligo, no, so they don't have their self esteem will be low. Is it required to give psychology counseling before the surgery?
Yes, very interesting question you asked actually. Psychotherapy plays a major role. Reassurance is a very important in the treatment protocol because particularly baby children, girl children who goes to school, the parents, the mother, generally we have seen quite a number of time, they come to me, and then the mothers, when we say that the child has developed vitiligo, then they really get upset and they start crying that all this can be easily assessed, and then probably we give a strong supportive care, and psychotherapy is also very useful.
Okay, doctor. So So food part, as you told, there's no specific diet for this food. So there's no restriction in having any kind of
No
food.
kind of anything. Generally, good food, vitamins, supplements, proteins, and fat have to be balanced. Diet is important.
Uh, the sun causes any vitiligo, brother?
Sun sensitive vitiligo is one thing, but generally sun can burn the skin, because if there are no pigments in the patches which are on the skin which is exposed to the sun, the skin can become red and then erythematous, and it can become thicker. So that we generally use a sunscreen for these individuals who wanted to venture out in the sunlight for sport activities.
So normally எந்த கண்டிஷன்ல டாக்டர் வெட்டிலிகோ வந்து ரொம்ப worsen ஆகும்?
Associated autoimmune diseasesல கொஞ்சம் வர்றதுக்கு வாய்ப்பு இருக்கு. It can also become more commonly in other associated conditions. இது கொஞ்சம் டிஃபிகல்ட் டிசீஸ். எப்படி பரவுறது, ஏன் பரவுறது அப்படின்னு நம்மளால சரியா கரெக்டாக ப்ரிடிக்ட் பண்ண முடியாது. ஒவ்வொரு தடவை பார்த்துட்டு அதை அசஸ் பண்ணோம்னா, ஐ திங்க் ப்ராபப்ளி வில் பி ஏபிள் டு foretell that this can behave like this cannot be treated, this can be treated, and these are the treatments which are always, whatever it is, the goal of treatment is make sure that patients do not develop any side effects. There are agents which can cause side effects, so that has to be clearly given, because this is a disease wherein it cannot be quickly treated. It is going to take time. It may take even years together to make the disease all right. If the repigmentation is not happening, we always choose the pathway of giving a camouflage cream. And many of the patients, when we counsel them, they accept the disease. So we have to accept the disease, make them that they accept the disease, and proceed to live a life with full of energy and happiness.
Melanin, there is what makes to reduce melanin, doctor? நம்ம பாடியில நார்மலா melanin reduce ஆகுறதுக்கு what will be the reason, doctor?
Mainly this, when you're talking about this vitiligo, this is secondary to an autoimmune process. The T cell goes and destroys the T lymphocytes, goes and destroys the melanocytes. Otherwise, generally, when you go in the sun, you get a tan, you become more darker. And there are causes of increased pigmentation, which we are not going to discuss this today. So we will focus it today, because this is a condition wherein disease is there across India, and it causes so much of psychological impact, and also causes a social anxiety that we have to, we in Apollo is doing it very, very well.
Okay, doctor.
Thank you so much for our listeners. Please do forward your questions so that we'll be able to address it at a later date. Thank you very much.
Thank you, doctor. Thank you for your valuable time, and it was very interesting to know about vitiligo in detail, and thank you for your information.
Thank you.